wrong.
Happy Tuesday. Go ahead and like and share.
Please do. Please do.
Share and like. Oh, sorry guys. It was my story. Did you just hug yourself?
It's on my story.
It was on my story.
Hey guys, how are you?
Happy Tuesday. It's Ladies Kickback Tuesday. Why I always get so tired?
I don't know. I have no idea. But it's real.
It is
Every
real.
time.
Every
time.
single time. I'm turning it down.
Jesus.
Hey.
Hello. Hello.
Hi,
Oh Lord, I'm talking about her, and I'm like,
exactly. Let me see. Like and share. Let me see. Well, I was supposed to go back on it.
like and share, people. That's what I'm doing.
Hey. What's going on, everybody? Go.
Happy Tuesday.
So here's the deal. If something happens here and it goes out, meet us on Instagram. That way you always will have a continuous feed going on.
And if you want to see our guest, she actually will be on our Instagram. Let's share.
Share. I got some new Facebook friends. I need you to click
Oh
on
my God.
them. New ones.
You got new Facebook friends?
I got new Facebook friends.
Oh, Lord.
So I'm sending it to you, and you better click. Mr. Rapper.
Oh. A rapper.
Well, I'm not going to say anything about that.
Just don't say nothing. Just click on it, because I see you saw it.
And if you guys do not have Instagram, we definitely will be uploading.
Catch the replay.
Yes, please catch the replay because we are on other channels and I'll be with y'all about that in a minute. But please tag a friend
Or two
or three.
Elder,
Inbox.
Elder, don't heart that. Click on that. Elder gonna heart me in a message. Click it, buddy.
Hey. Okay.
That's my son.
Did y'all do y'all what is it? The Facebook story. Because he wouldn't let me do
You
my
know
story.
what? That's right. That's the best thing to do too.
It would not. There you go.
It ain't what you did.
I just went. I had to go to Brain, share it to my personal
That's right.
page,
That's
and
what I need
then
to
go.
do. That's what I think I need to do.
Yeah, I'm good.
Hi. I know. Hello, everybody.
Good evening.
Good evening.
Welcome to Ladies Kickback Tuesday. Hello. Hi, Instagram. Hi, Facebook. Welcome to Ladies Kickback Tuesday. We are here on this Good Tuesday, and we are super excited. Tonight's gonna be a good night.
It's going to be a great night.
You know. It's gonna be a good night, though. Honestly. Like I said, please like and share. Like the page. Share with a friend.
Yes, please.
We are not only on Instagram. We are not only on Facebook. We are also on YouTube. We are on
Apple.
Not yet.
Hey,
Apple still have
I'm not going to say the cuss word.
If y'all know, Apple is very difficult. So we're not on Apple yet. We actually went in and tried to do it. They taking their time. But anyway, we are on Anchor, Shopify. Why do I keep saying Shopify?
Spotify. I don't know if she want to Shopify. Why do you keep saying Shopify?
Shopify is actually a website.
It's a platform.
It's a platform.
Okay, so we might need to be
So Spotify, iHeartRadio, Google Podcasts, and I think that's all.
That's it for right now.
For right now. Yeah. But we are on 7 platforms, guys.
Yeah, so join us. If you can't catch it right now, come back for the replay because we in it to win it.
Go check us out.
Okay, guys.
All right. So, we are going to get in because we got a good show tonight. So, listen. I feel like governing ourselves according because we're in the church.
Govern yourselves accordingly. Just shut up.
Don't be ashamed. Anyway, so listen. At the end of the day, we are here to be able to push everyone who's in business, who's getting ready to go in business. Yes. Just to live at your greatest, not even in business, but self-care and self-healing and all those amazing and great things. So I got a call this week, and I was asked if I could announce, which I'll actually be there. It is called Mindset Mondays, and it is a room, a private room where businesses who are already small businesses who are already in business or someone who wants to be in business. It's called Mindset Mondays. And it is called, it will be on March the 7th at 5:30 p.m. to 7 p.m. And the address is 106 Market Street. Again, 106 Market Street. And it's at the building called Channel. The Bank Live Oak opened a space for all small business owners. And I think it's amazing that they have opened a space for us so we can be able to go and network and do business.
It's a beautiful thing.
So I'm super excited about that. You know?
Yeah, can you hang with it, sir?
Silly.
I came.
She cutting up tonight, y'all.
Yes.
And here she goes. So, business of the week is Girl Talk Movement.
Ooh, I heard that.
Girl Talk Movement. The owner, founder, and director of this business is Samira Bell Merrick. She she just got married. Well, she's been married about 2 years. I think she actually just had her anniversary. But her Facebook for this business is Girl Talk Movement. And her website is www.girltalkmovement.com. And this particular business is gearing towards young girls. She does a lot of community with the young girls, activities and things like that. I think it's a great program. I think one year, about a couple of years ago, I hit her up. It was laid on my heart to make some bracelets, some jewelry for the little girls. Actually, it just came up on my memory timeline a couple of weeks ago. But go and either support, donate, volunteer. I'm sure she would love that. If you have a little girl and you want to do some type of activity, and I need to see what ages is because I have a little girl. She's 9, so I'm actually going to look into that a little bit more deeper. But go support. I'm always going to say that. We're going to always say that. That's what we're here for. So definitely go look her up. Like I said, she's on Facebook. She has her own website, and look her up and support. Be of some help. Do some community work, service. Donate. If you donate your time, if you have a craft or something, go help. So that's it. So we are going to do a game.
Oh shoot.
Oh. I was not so. You should have pre-warned me by the game.
I was about to say, where I know it.
I'm like, okay.
Look, I didn't do it last week, y'all. So I mean,
and I'm seeing having.
It was just 2 of us, so it wouldn't have been fun. But I got them both back.
Really?
Yes, this week. So the first one I'm going to do, first little game I'm going to do is, what do you think? What's the first word you think when you hear a word? So.
Hear what?
What's the first word that comes to mind when you hear this word that I'm about to call out?
Oh, Jesus.
Okay?
Okay.
Y'all ready?
Go ahead.
Exam.
Breast.
Uncomfortable. So uncomfortable.
Little box.
Terrified.
That speculum sucks, man. They need to get a better method of how
Metal. Cold.
to maneuver around that area.
I'm talking about exam. Your boob and this little tiny.
And then they scrape you on the inside, and they say after you know,
Be relaxed.
you done came off your monthly. You gonna scrape me again, heifer? Find another method. Tired of bleeding.
Okay.
Shoot.
Be 5'3" and trying to tip on your tippy toes, stick a big old thing up in this little tiny box.
Really?
Oh yeah.
You ain't never had no mammogram.
Yes, I have.
Yeah.
Yes.
Mammogram ain't no joke.
And they hurt.
It
that
hurts.
should be a crime.
It should be. Why do it have to be hurt? Just
And then they say, I'm gonna need it to be flat.
and don't put no perfume on, no lotion.
Oh, I can't wait. I guess.
Make sure you don't lean into it.
You lean into the side.
I know it's uncomfortable. Oh, I
Stand
know it's
here.
cold.
Hold your breath. I don't want to hold my breath.
Try not to move. I am 5'4" and a
I'm on
half.
my tippy toe holding this big old thing up in there. That don't work. So
Okay. So y'all see the word gazelle, how they feel.
but you gotta do it.
But you gotta do it. Energy.
Where is it?
Energy.
Oh,
Gone. Yeah.
bye. Take some vitamins.
Y'all, I'm probably the worst. I get me a good energy drink.
B12.
Those are not good for you.
They ain't good, but they
Really?
good.
Not good
What's your
for you.
favorite?
Now it's dragon fruit. The dragon.
The dragon fruit
But you
Red
can't
Bull.
find it so much. I'm sorry. It's on one of my friends
I know.
that's listening. He told me don't drink them no more. I do.
Not good.
I'm addicted to them though.
Okay.
That's not good.
Yeah, I need them.
All right. So,
He said I need them.
in 1968, blank was assassinated. A. Dr. King. B. Henry Blair. C. William C. Carter. Or D. None of the above.
Is this a trick question?
That's the question.
See, it
1968.
wasn't MLK because my mom was not 6.
Yeah.
Um,
Was it nobody?
Is anybody on here? I mean, we can't see y'all. My
People
bad.
like they raising their hand. Or waving.
They waving.
Um,
Do the audience know?
I think none of the above.
I'll say it too. Cause
Okay, y'all. My
Cause
my
I was
husband
19.
missed mine.
No,
It
I'm
was-
trying to get him
It was
like
1968.
I was born
Yeah.
75. No, he been gone by then. So
Yeah.
do that.
I think my mom was 3.
I said who? I ain't say he.
No, I'm just saying I was on point.
But it was somebody assassinated. Do y'all know?
Who?
In 1968?
Mhm.
Was it Michael X?
Yeah. Oh yeah. There you go.
Smart.
Look, y'all. She did her glasses. Was it Malcolm X?
She fixed
She
it.
fixed her glasses, y'all.
Look like Miss Sneed. Look like.
Wait a minute!
Y'all, I wish I would have seen it. She fixed her glasses real quick.
This is nothing.
Alright, who invented the traffic light? Matthew Cherry, none of the above, Garrett Morgan, or Frederick Loudon?
Garrett Morgan.
Oh, you better.
No, but I teach my girls to do
Their own Black History.
No, they have to do something every day.
That's good.
Black History Month. Simone actually, she reads an announcement at North Brunswick, and she incorporate a Black History fact every day.
But the other two people are inventors or something. Frederick Loudon, he invented the keychain.
I didn't know that.
And Matthew Cherry, he invented the tricycle.
I did know that. Yeah.
So yeah, hey y'all. So go ahead. I was trying to give you guys some time to like, share, tag a friend. And we are getting ready to get into the word of the week.
Dang, it's my turn.
Your turn.
Awareness. Please be aware. Please be aware. The word of the week is awareness. Knowledge or perception of a situation or fact. My. Awareness.
That
Be
word-
prepared to walk out when you have been made aware of something.
That word had
Be
me all
prepared
week.
to let go of when you've been made aware of something.
Baby.
Be prepared to close the door. Don't answer the phone. Unplug the cord. Take it
Girl.
out the wall. Put them on the block list.
Block.
Block. You're blocked.
And you know that they are blocked because they're going to call you from a different number.
Hey. They're gonna get text now and be calling you.
Be aware that if you're in a room hugging yourself, rocking, then you need to get away from some people and situations.
That is, be aware of your hair.
Hello?
Yeah.
Be aware because you ain't got no edges.
That's that part.
Stop wearing them braids. That's too tight.
You know
I'm
what?
just saying.
That's true.
Rosemary don't work for everybody.
Nope.
It's called tension.
And stress. And stress.
But awareness, being aware is going to be one of your greatest gifts. It's like discernment.
Mm-hmm.
Utilize awareness this week, people.
Yes.
The female is Charlemagne the God.
So, tonight is great.
That's great.
We're gonna have a great interview, a great conversation.
I have a lot of questions.
And it is about how's your health. Let me say that again. How is your health? Toni, I don't know if you are on Instagram or you on Facebook, but if you can move over to Instagram so we can chime you all the way in.
She's on Instagram.
She is right now?
Mm-hmm.
All right. Can you push the request button? Let me see. I think she said that, is she up there? See, you can see it. Let me
These glasses just work on seeing up front.
see. They just see up front.
Yeah, they see right
Near the
yeah.
front.
Yeah, they can't see that far.
Let's see if she can, she might have to come in and go back out so we can see her. Let me see. Let me see if I can get on it.
See if you can add it.
Let me see if we can add it. Let's see.
That would be nice.
Yeah, she's saying there's no request button.
Did she go in? Tell her to go in. Did she go in and come back in? Oh,
Is she there?
they said join request.
Mm.
Send a request. I can.
I think you can send it. Right?
Are you on Facebook?
I'm on Instagram.
Okay.
Are you on your cell phone? Request to join. It's gonna let me join.
Send a request to be in Brilliant Brains or Women Live video. It
She
should
said
be at
yes.
the very top. You should see a little.
It should be at the top. Hey. Uh-oh. Did she join it? See if it's in. That, push it. Push it. Yeah, push that button. No, that's me.
That's Facebook.
No, that's Instagram.
Okay.
Which
See if you
one?
see a request come up there. Push that add button.
Where?
You right there. You see that little person?
Yep, there you go.
There you go.
Person.
Yep,
There
there
you
you
go.
go.
There you go.
Hey! Hi,
Oh,
ladies.
you might have to turn up the volume. Turn up the
How are
volume.
you?
Turn up the volume. You see it, Mama? Oh, no.
Turn up the volume. Can you hear me?
Hey, Instagram.
I can hardly hear you guys. Let me grab my ear pods. I can hardly hear you guys.
All right, Facebook. So let us know if you guys can hear. Are you on your cell phone, Toni? Okay.
I am.
Okay. We can't hear you. Oh, it went out.
Can you hear me now?
Yes.
Yes.
Yes. Facebook,
Can you hear me now?
guys hear us?
Can you
Yes.
guys hear me now?
What about? Let me see if Facebook can hear. Let me go back on.
We can hear you.
Let me see if Facebook can hear. Let me see if anybody. Can y'all hear us on Facebook? Toni, can you say something? Okay.
Something. Hey, y'all. Acacia can
y'all
hear.
hear
They're saying
Toni?
they can hear.
See if
Can you
they
hear me, guys?
Hello, we can hear you.
Hello.
Okay.
I see a couple.
So,
There are a couple people
hey,
on Facebook.
Toni. I am super excited.
Hey, how are you?
She said she got a lot of questions.
I'm ready. Let's go. Let's go. I'm super excited too. I feel ill prepared, but today's been a crazy day. But I'm excited to be to kick back with you ladies. Yes. So it's crazy. I was just saying, first of all, I just want to say thank you for inviting me. And then also I was excited to see that Aisha is usually on your panel too. So
really?
She is a high school classmate of mine.
Yep.
Yes. Yes, I love Aisha. I was hoping she was going to be on the panel with you guys. So
yes.
I have to get in with her later.
Oh Lord, where do I start? So they were asking about our background. So we grew up in church together. That's how we met. We grew up in yes, and in the same neighborhood. And we in the same neighborhood. Together, Lord. So we and our parents were good friends. So that's how we know each other. So we're super excited because even talking to you and we be calling Facebook and social media like stalker each other because we see what each other is doing. So I am super excited to talk about your new business. Mm-hmm. You are in the healthcare. Not only are you doing the healthcare, you have your own practice. So not no shame, no one else's ethnicity. But you're black. You're a black woman. So, right. So amazing. Super excited.
So amazing.
I would travel to you.
Yeah, because she was asking. She was like, I said, oh, she do telehealth too.
I'm like, for real.
So,
that's amazing.
I mean, you kind of have a conversation. I wanted to ask you some questions about what made you open up your own practice. Mm-hmm. First of all, let's talk about the name. I'm gonna do this again.
Oh,
Concinnity.
Okay.
I did right. Okay, I just want to. Concinnity.
Yeah, Concinnity.
And Concinnity.
Now you messed it up.
Oh, okay.
Right, you did it right the first time, then you messed it up.
So what is the meaning of that?
So Concinnity means the skillful and harmonious blending of things. And the reason we chose Concinnity Health is because when you think about how your body systems work together, God created it all to work in sync, to work in harmony. So I chose Concinnity because we think about when you try to bring your body back to a continuous state, you're bringing it back in harmony. So that's what healing is.
This is word over here. So she's sucking all of it in. That's good. Mm-hmm. And so and you do direct health care, right?
Yeah.
So tell us what is direct health care, because everybody doesn't know that.
So direct primary care is just a different model of healthcare, of primary care. It is a type of healthcare that affords our patients unlimited office visits, direct access to their provider, me, or whoever their provider may be, extended office visits, meaning instead of you having that rushed 15 minutes of office time, you get extended office time where we can handle and discuss whatever issue you may be dealing with at the time and not say, hey, wait till the next appointment. And so we do that by eliminating who we call the middleman or insurance. So as a direct primary care provider, we do not bill insurance. It is a membership-based platform or model where you pay a membership fee once a month and you get unlimited access to your provider, all for a one low monthly fee.
I love it.
I'm just
I mean, because honestly, this is even good for people who are self-employed, who are business owners as well too, who may not be able to have the insurance yet.
Mm-hmm. Or it's even good for people like
Absolutely.
who have Medicaid, but you only get like the family planning Medicaid. You know what I'm saying? Because I know somebody who has that, and they only get family planning. And like my mom, they try to give her that. She's too old to need family planning. She ain't having no kids.
Right. So our niche when it comes to healthcare is we try to reach that ground of people that are not being serviced by any other health institution, meaning those that are uninsured or what we call underinsured. So, and those typically sometimes are your small business owners who can't afford to pay for the private healthcare for their employers, their employees. So we offer the membership-based program to them as well. And we do have like small business plans that we do. So yeah, we're trying to reach those people that typically fall in the cracks and make sure that everyone has
that is good.
That is absolutely amazing.
That is so good. And you don't hear of that often at all.
That is absolutely amazing.
Give me your insurance card. Man, we cannot serve you today.
Right.
So
right.
that is awesome. So what other services do you provide? To just give us a briefing. What other services do you provide within your practice? First of all, hold on. Before I even ask you that, what is all your certifications?
That was one of my questions you took.
It's our question. Would you like to answer that question?
Yeah, I just want to know what are your certifications, and also so people will understand the difference in a nurse practitioner and a doctor. If you know what I'm saying, I know the difference, but some people might not know the difference.
Mm-hmm. Yeah. So I know I have to call you Tashelle.
Yes.
While we're on here. Okay, I will call you Tashelle. Okay, so you asked me earlier like what my initials stand for, or what are my credentials, what are the letters behind my name. So if you see my name, or if you see my name on the flyer, it's Toni Kenion, MSN, APRN, FNP-C. So MSN stands for Masters of Science in Nursing. So you see behind me, they're all of my degrees. Okay. All of my degrees. So Masters of Science in Nursing is MSN, and then APRN stands for Advanced Practice Registered Nurse, and then FNP is for Family Nurse Practitioner Certified. So that's what the letters stand for. So the difference between a nurse practitioner and a doctor, in essence, I am trained to treat, diagnose, and evaluate primary care patients. So on a family practice level. I am a nurse at heart. I will tell you, I'm a nurse through and through. I was first a nurse. I'm going to always be a nurse. The only difference is I've taken enough training so I can go beyond just what typical nurses do at the bedside or in urgent care facilities. I now have the ability to diagnose, and I can treat and then evaluate afterwards. So I would never tell you that I'm a doctor. I would never tell you that I will even compare to the training that a doctor has. But I flow in my scope. I know where my training is, what I can handle, what I can't handle, and I only operate at that level. Doctors have trained for many, many years. They have a lot more extensive background knowledge on certain disease processes. So, I have been trained to treat in a primary care setting from ages 0 to whatever. So
that's perfect. That's amazing. Like I said, I already knew what it was, but some people might, you know what I'm saying? What it was, I don't know. It's all the same to me.
That's what I'm saying. I know you're not a doctor, but you do doctor stuff.
It's not. Yeah. One other thing I would say about being a nurse practitioner too is we kind of approach things a little differently than a doctor. You hear people say like, "Oh, I prefer to have a nurse practitioner than a doctor." It's just we are first trained to provide care on what we call a holistic manner. Meaning, I'm not only just looking at you as far as what I can prescribe. I'm looking at you as a whole person. So I think about what type of culture, what's your culture like? Even your spiritual well-being. I mean, so we look at you as a whole person, and that's what we do as nurses. So I'm a nurse first, but I just have the ability to add those other pieces on. So I think that's what sets us apart and makes us a little different than when you see a doctor versus a nurse. That's like I said, no one is better than the other.
I
We
will
just
always
approach
prefer
things a
nurse
little different.
practitioner over any. Yeah.
Okay. So, like I think I asked you earlier, what made you go into the field though? Like you just starting, what made you go into it?
So, as a kid, I've always wanted to be a doctor. That was like my dream. Are you guys still there? Okay. That was my dream, was to be a doctor. Went to my undergrad. My first degree is in biology because I was going to go to med school. But life happens. I got pregnant with my daughter. I've been with my husband since high school. I married my high school sweetheart. So I got pregnant with my daughter my senior year in college. And I made the decision, am I going to be a mom or am I going to go to med school for 8 years? And I decided that I wanted to be a mom versus, spending the first 8 years of my daughter's life being in school and worrying about residency and all of that. So I've always, like I said, I've always wanted to practice medicine. I knew at an early age that that's what I wanted to do. And so once my daughter got a senior year, got her into her senior year of high school, I had to go back and reevaluate myself and say, who am I as Toni? And what is it that Toni wants to do? So for 18 plus years, I was mom, and I wanted to make sure that I gave my kids all of me or what I could give. And so when her senior or right before her senior in high school, I was like, what do I want to do? I decided to go back to nursing school. I went, got my nursing degree. I did it in 1 year.
Fast track.
I did the accelerator program. And then I worked, and then I decided to go back to school and be a nurse practitioner. Well, I knew I wanted to be a nurse practitioner before I went to nursing school. I talked to a couple of my girlfriends who are nurse practitioners, and, we discussed the difference between an NP and PA, and they kind of helped me make the decision. And so I knew I wanted to go back and become a nurse practitioner. So that's my reason. I've always wanted to practice medicine. I always wanted to be in this field.
You are absolutely
awesome.
And so here I am.
You are absolutely amazing.
Never too late.
This is so good. I'm amazed at what you're doing. Like, that is amazing. And so what services do you provide for primary direct care?
So we do whatever you would normally get at any primary care office. Like I said, the only difference with us really is the model of payment. And then because of our model, it adds some of those other benefits on that I talked about. So of course you can get your annual wellness exam. We do preventative healthcare screenings, chronic disease management. We do all of your testing in-house, like COVID, strep, sick visits. We do sports physicals. We're working on getting our DOT physicals in the house. So yeah, I mean, it's a primary care office.
I'm just getting on now. I really, because and like I told you, I'm like, it's a difference when you personally know someone who's doing this. It's a difference. You hear it in Atlanta, places like Atlanta all the time, where you see it on TV where it's American medicine. You see it like that, but you don't see it, or you don't hear it as often as you hear it actually knowing someone. So I was like, I definitely, had to put you on here because I was like, I just need to know everything. So what would you say I'll say 3 important checkups that I'll say in general that we need to have?
Oh, it's so many, but you always want to do to start off with, just wanting to make sure that you're doing those preventative health screenings. If you follow me, or if anyone has been looking at my Concinnity health page, you'll see I post about preventative, and then I did about the differences and things you need to do for preventative health. I'm really big on preventative health because we can find some things early. And some of the things that are included with doing your preventative health screenings is checking your blood. First of all, as a Black women especially, making sure we know our numbers. So know what your blood pressure numbers are. Know what a normal pressure is. What does it look like when your blood pressure goes up? Okay. What does it look like if your blood pressure go down? Your blood pressure shouldn't be too low either. So that's the first thing. You know, do you know what your blood pressure is? Blood pressure in the Black community is what I call a silent killer, meaning your blood pressure can go up and you never even know it. So if you're not checking it on a regular basis, you may be living with hypertension and damaging your heart, your kidneys, and some other organs. So that's the first thing that I think about that comes to mind. Also, what is your heart like? Looking at heart health. Are you doing your cholesterol screenings? Oh my, so many other ones. Let's see, what else would I say? Those are the bases when you're thinking about. Two I think of off the top of my head when you think about physical health. But like I said, as a nurse practitioner, I think about physical health, but you also got to include that mental health piece in there too. And then even your spiritual health. But I'm big when it says mental health and physical health. So I'll add the third one is,
that's it.
Let's talk about your mental health.
That's it.
So,
and it's
somebody on here, I'm seeing some posts. Somebody said blood sugar. Yes, you want to definitely check your blood sugar too. That's important. So there's a couple of other ones.
I'm glad you can see that.
Oh, I can see it. Yeah. So there's somebody on Instagram. Somebody on Instagram has commented. So, but there's some other things too. You know, of course, you want to always check your blood sugar. You know, you get a certain age, you want to have your colonoscopies, your mammograms, your pelvic exams. So just making sure that when you're talking to your primary care provider, that you're getting and covering all of those preventative health screenings. And then, of course, in our community, we think about heart disease that can lead to stroke and, you know, a whole lot of different things. So if we're focused on preventative health care, your primary care provider should be covering those
what
things.
What do you think about, because I seen someone talk about too, the thyroid. Because usually when someone, usually I hear people say is when they feel like something is off. And that's one of the things the first things I hear them say, like, about your thyroid. So should you get that checked off then, or? Okay.
But do they check when you
Yes.
T levels? Is that found
Yes.
in your complete panel, or is that found in just something you do on like?
Ask your
So,
question again. I didn't
when
hear
you
you.
check your thyroid, do they run that on the complete panel, or is that something that you can do like every 6 months, or does it have to be done yearly?
So I, as a provider, I always include a thyroid, we call it a TSH. I check your TSH levels and I check your T4 levels. That's looking at your thyroid. So that's always one of the labs that I always include in your routine labs for like your annual wellness exam. Because of that is something that you want to keep a check on, because again, it's just like blood sugar, sometimes blood pressure, it can fluctuate or it can go up and you may not even have any symptoms of it until you actually have a disease. But to answer your question, it is not a part of your what we call a complete metabolic panel. I think maybe that's what you're asking about. So there are a couple of different things when you do blood work that you do. So a lot of times we check your blood counts, we look at thyroid levels, look at your electrolytes, look at, you know, a whole bunch of different things, and just a basic panel.
She got questions, she said.
Okay.
Go for it. Let's go.
One of my questions is it harder for people who are experiencing fibroids to lose weight compared to somebody who doesn't have fibroids? Like, does that throw the chemistry off, or are there ways to get around fibroids and lose weight?
Not quite sure how to answer that. Different for different people. I really can't say, look at you and say, oh, you got fibroids, it's going to be hard for you to lose weight. It really would have to be, we need to do a full history on the specific individual and see, you know, are there any other underlying factors? But to just specifically say fibroids itself, no. Now, there are some disease processes that, you know, like PCOS that you can have that causes like weight gain, insulin, Lord, I just threw fog. Insulin resistance. So there's some disease processes that can cause issues. So I can't just pinpoint and say, yeah, thyroid. I mean, if you have fibroids, it's gonna cause you to gain weight, you know. So it's individualistic.
Another question I have is, how early should we as women get pancreatic screenings? Because it seems like I've been reading a lot more about women coming up with pancreatic cancer. Like, when should one start to look at that?
So I would say it's not something that you do routinely. However, if you have family history of pancreatic cancer or any diseases of, pancreatitis in your family, that may be something you want to discuss with your primary care provider. But it's not something that typically in a primary care practice we just do routine. We do, some of the labs that we do that are routine, it does look at like your liver, your gallbladder, your pancreas. And if those numbers are typically in normal range, we don't usually say, hey, we need to do anything deeper, unless, like I said, if you have some symptoms or if you have a family history of, pancreatic cancer or issues with your pancreas. We usually don't. That's usually not one that we always focus on.
I have another question. So in order to become a patient, the first visit, would you say they have to come inside there to the office, or do you do online?
You ready to join? I can see your patient agreement right now.
Yes, I am.
So, would like to put my eyes on my patient for the first time, but depending on the circumstance, I'd have to see.
With me, I would want to go
if you're a pretty healthy patient and we don't have
somebody like me, I would want to come in the office first, and then after that, would you recommend be seen like on online type thing?
Yeah, we definitely do telehealth. I will say for locally, for 25-mile radius, and actually it's probably gonna be more than that. Those people that have a membership, they get one in-house call a year. Well, see, again, I'm a nurse, so you can learn a lot going into a person's house. And so a lot of things I don't have to ask you, I can assess just by stepping into your house. So you can say, no, I'm not exposed. No one smokes around me. But if I walk in your house, I know somebody's smoking around you. So now I'm concerned about, what's your respiratory function like? Do we need to do some more testing here? So it gives me a better, broader and better picture of what the patient's life is like outside of the practice and some of the things they just may forget to share. So, but to go back to your initial question, I would probably prefer to have you come into the office first to say you have to. If you're pretty healthy, we may make.
And you do all your blood work in-house?
So we draw all labs in-house, but right now LabCorp is who runs our labs for us. So yes.
I'm about to be signing up when I get out.
This is so good.
Okay.
I just never knew that it could be this way. Because like I say, you don't hear that many nurse practitioners coming up with their own stuff, their own rules. Let me see if I have any more questions. I don't even know, because you just don't blew my mind.
Literally has blown my mind.
Oh, let me see. I think
and you see, of course, you see guys too, right?
You see males as well too, right?
Yeah, we see ages 5 to 100 and whatever.
So you start off at 5-year-olds?
Wow. So you see kids, honey. You is like you is absolutely
This
amazing.
is good. So if you don't,
she's a family nurse practitioner, so you see the whole
entire family. You want to see my 2 kids?
Baby,
because my son needs a sports physical right now.
You about to have a whole bunch of patients. I'm just telling you right now, and starting with my household.
Now, you ever thought of doing like pop-ups though in different cities? Pop-ups.
Doing what's that?
Just the idea. Pop-ups.
Say it again. No, but that's a good idea.
It just came to my mind because you are your own practice. I think that would be good to pop up in cities and do provide your services.
That's a good idea. At least if I need to, I can do it at your initial visit in another city, and then I can do telehealth with you after that.
That is good.
I like it.
I like it. Over here trying to.
I like it.
That is good.
Trying to get these patients in.
Honey, that is good.
You know you can do pop up in Wilmington.
Yes.
Anytime. But I was just sitting here thinking about it. Yeah, I think it's worth the drive. I'm super proud of you. I really am. This is amazing. So Facebook, I don't know if you all are still on there. You might want to definitely go look her up. And it's Concinnity.
Concinnity.
Right? Concinnity Health. Yes.
ConcinityHealth.org.
We'll put it on the thing.
Yeah, I'll put the information up.
But you're gonna be seeing me, so just be mindful.
She ready too.
Okay.
Yep.
I'm ready. It's right behind me.
Yes.
Probably
We still
backwards.
see it.
We're still seeing. I'll put your information up after this live. I'll put it up on both places.
And online, can you sign up online with the paperwork and stuff before you make the appointment? Gotcha. Okay.
So yes, so we have the ability to get everything to you pretty quickly. You can go online and schedule your first appointment, or just do a meet and greet. If anybody wants to do a meet and greet is a virtual visit. We just talk about what we are, who we are, and what we do as direct primary care. I talk about just my philosophy on being a provider, and that's just a free 15-minute virtual visit. Answer your questions, and then at that time, if that's something that you decide to do, then we'll send you all the paperwork for the agreement, and just get you started.
And you guys, you're outside of Raleigh, right?
Yep, we're in Roseville. We're right
Roseville.
outside.
Okay.
So she's
kind of in the corner
outside,
of Raleigh,
Roseville,
and Wake Forest,
North Carolina, right? Okay. Okay.
Yep, Roseville.
So this is amazing. This is good. I can't wait to see how this thing. I'm gonna have you on here. I definitely want to have you on here because I like your beginning and your future. This is amazing. I wish more people would do something like this.
I like to see more brown people doing things like this.
I love brown people.
Yeah.
It's very inspiring.
And that's what I was, we were talking about. I said, a lot of people, growing up, mom and them did not take us to the doctor all the time.
Mine did.
Not all of us, but I know I didn't get to go to the doctor like that. Only for something like extremely wrong. Because, even back then, I don't think it was a thing to go to the doctor and get your checkups. And it depends on what household you grew up in.
Mm-hmm.
Of course, in my household, we rarely got sick. So, because my mama had us sheltered.
That's a blessing.
But I have been, for me personally, I've been looking for a doctor that I can relate to, you know what I'm saying, that's brown. You know what I'm saying? Because some doctors are trying to make you sick, and it's like, no, you know what I'm saying? Instead of knowing that I'm the first one who understands me. You know what I'm saying? So that's actually funny thing what I've been looking for. Like, seriously, no lie. For real. So
I think
there's so many unspoken things in cultures.
Yes.
So in every culture, there's things that's unspoken that you don't have to share. You don't have to talk about. So I think one of the benefits of having someone who looks like us, being able to care for us in this manner, it makes a big difference, because there's some things that's just unspoken that you don't even have to tell me. So that's what I appreciate about being a brown provider. And being able to be somebody that's accessible
that is
to our community.
Amazing. I'm at
So while y'all are waiting on questions, I want to say, Miss Nixon, I am extremely proud of you. You talk about me, I'm proud of you as a young entrepreneur doing your thing. For those of you that are watching, y'all see all that stuff behind her.
Exactly.
Y'all go shop.
Please do.
Go shop.
And I'm
business So I'm all for and supportive of entrepreneurs of brown skin. So Black entrepreneurs, yes, I am
Thank
super
you.
proud of you
And
as
this is
well.
what this is all about. Just, having these moments like this to celebrate each other, motivation, encouragement, whether you're in business or not, like just to know some of our audience or whoever's going to listen to this later on, that may not, they can't afford insurance. And so, you're offering this type of service, like, this is amazing. Like,
This is crazy.
because in our mind, like, all you think about is, oh, I gotta get insurance, oh, I gotta get insurance. But then, you have some of those families who really just can't afford it. And so
Right.
I am willing to do whatever I need to push and make sure I bring everybody to you. Everybody to you. So, if there's anything we can do, please let us know. You know me. I'm not going to call or text away. But I'm definitely going to have you on here again because I just want to know. I'm interested in the growth. I like to know the beginning of something. I like to get on the ground floor or something. I know that's probably so weird. And I like to see the growth and the change. Because people think, oh, when you open a business, I've told you, like, oh, you just make this ton of money at the same time. And it's like, if you only knew. It's a push.
Girl, I'm still waiting on some money. I'm still waiting to make some money. We haven't.
Absolutely.
We're believing God, but I've been open. We haven't been open for a month yet. So our grand opening was on Martin Luther King, the day we celebrate Martin Luther King's holiday of January 17th is when we did our ribbon cutting and grand opening. We've been getting a trickle of patients in. But again, it's just about educating the community. We know that once we kind of get the word out and people understand what we do and why we do what we do, we'll get that. We'll be able to tap into that group of people that we're trying to reach.
And definitely, I am going to. Do you come and do like classes? I guess health classes, you can say. Because I know of a place that I was talking about in the beginning. A lot of small business entrepreneurs who may not work their 9 to 5 or actually may work their 9 to 5 who do not have insurance. So in their mind, they don't get get the opportunity to get that yearly checkup and stuff like that. So I definitely want to be able to bring your name up to someone else that I know that you might have to. I mean, you probably can do a virtual like this, but definitely small business owners do need to know about this because sometimes people make enough money, but they can't afford the insurance. So it's like they keep the 9 to 5 so they can have the insurance. So someone like you that provides that type of care. I definitely want to be able to connect you with some other people that I know myself personally that be able to connect to you. Exactly, and I know the business owners who wants to come out there 9 to 5, and they're only there because of the health. So, I got you.
Right.
I got you on this side over here.
Yeah. So no, just let us. We appreciate you. I know you got me. I wouldn't be on here if I didn't feel that you did. But yeah, we are more than happy to talk to entrepreneurs, small business owners, and talk about even like I said, we have employer plans depending on the number of employees that you are willing to bring in. So, for example, we have one company that we do. So it just depends. I was going to tell you the price, but it kind of depends. So it kind of fluctuates. So I don't want to say that. But I will say if you do at least 5 or more employees that sign up, then it is less than our monthly fee. And one of the things I didn't share with you guys is what our actual monthly fee is. So for ages 20 and over, it's only $75 a month.
Oh,
and for kids ages 5 to 19 on a plan with another adult, it's $25 a month. And then we also do a family plan of 4. That's 2 adults and 2 children, $475 a month. And that includes all of the benefits that we talked about. The only thing that you would have to come out of pocket for is maybe paying for labs. And then eventually we are going to do, will be a dispensary as well. We're working on that through the Board of Pharmacy to become a dispensary. So instead of going to the pharmacy to get your medicines, when you leave here, if you need your metformin, you need your amoxicillin, whatever you need, we'll have it in-house. We'll dispense it before you leave.
Do you do skin stuff?
We're working on that as well.
Do you touch on people's skin?
Amazing.
Do you touch on people's skin?
Do I do skin stuff?
Like,
it depends on what's going on.
I mean, you can tell. I'm asking you for a reason, though.
It depends on what you have. Again, anything that you can go to your primary care provider and see. If it's something I can't handle, then we do refer you to a specialist. We still do that. And then I guess that's segue into saying that one of the things we do ask our patients to do is to have what we call either like casualty or hospital insurance, if you can. That's high deductible, low cost insurance. It pairs very well with direct primary care, because if you ever had to go to the urgent care or ever have to go to a hospital or ever leave a specialist, you still have insurance to fall back on, and you won't get hit in your pocket really hard. So we do mention that. But yeah, so anything that you can get seen, I guess, if you got some issues with your skin, I'll take a look. If it's something I can't handle, then we'll try to find you the best course of action.
Okay.
Or what you need.
All right. Do y'all have any more questions? She over here shocked right now. I'm just days. Because, I mean, you know, you're out there, so you know how much insurance, health insurance, and all of that is. Like, I mean,
I don't even know what to say. Like, I'm just so like.
So I am definitely going to put your information out there. You should be hearing some more from me, because I just got introduced to a small business. I don't even know what to call it, but they definitely need to hear from you. Definitely. So I am super excited. Do y'all have anything else? They just shot right now.
There's somebody on Instagram with there's somebody on Instagram with a question. She says, "Glow professional, how did you manage stress during nursing school?" Ooh, child, Jesus. How did I manage stress during nursing school? Oh Lord, let me think. Nursing school or nurse practitioner, so they were two different entities, like two different types of stress. Nursing school was one type of stress, and being an NP was a different type of stress. So I would say I had a very good support system. My family was very, very supportive. My husband, my kids, they were very supportive during nursing school as well as being an NP. And then I leaned heavily on my girlfriends. Like when I was like stressed out and just wanted to fuss and curse everybody out, I truly leaned on my girlfriends. And because I have a really real strong like core of female friends. And they were very supportive. They listened to me moan and complain, and you know, so I kind of rallied, allowed my community to rally around me. That was one of the biggest things. And then one of the other things I try to do, and I say try because I didn't always do it, was I try to take breaks when I needed to. So did I answer your question, Glow? The Glow professional?
I think so.
Yeah, I think so.
Yeah.
She's on Instagram.
I'm trying to see if she responds.
Yeah. Okay.
This is good.
I'm just so shocked right now. I don't even have no words.
Hey, Kristen. Oh, that's Kristen. That's my Kristen. Hey, girl. That's my girl.
Hi, Kristen. Thank you for joining us.
That's one of my babies. So I know this is I'm on somebody else's platform, but because I see her on here, Kristen is also a young entrepreneur. She's not an entrepreneur, but she's kind of got her own thing going on. She is a esthetician, and I'm not sure the name of her salon, but she is doing great things in your area. So if you guys are looking for an esthetician, she does great work. I got to shout her out.
She's a woman.
Oh, we need to talk. Kristen,
That's
She in Wilmington?
we need to talk.
Kristen, are you in Wilmington
Yeah.
or Jacksonville? She's
Kristen,
either in
where you
Wilmington or
located at?
Jacksonville. She's from Wilmington. She's one of my former students.
Where's she located?
Where's you located at?
Jacksonville.
Drive Ivy Hydration and
Okay.
Med Spa in Jacksonville.
Kristen, I do the body sculpt there too. I got my little spot on the other side. Y'all can't see it, but
Oh, wow. And she's located.
yeah,
I didn't know that.
It's called Divine Brilliance Spa. It's on the other side. Do yoni steams, foot detoxing, body sculpting. Yeah.
Okay. See, look at you. Look at you. You talk about me.
I'm trying. Listen, now I know I definitely on my 9 to 5 one of these days. So I'm coming to you from my probably account. And the kids coming.
Exactly.
There you go. There you
There
go.
is hope.
Let's talk.
I know I'm coming. As soon as I get on the charge my phone.
Do anybody else? Let me see. Lord, Facebook, sorry, y'all. I was so intrigued. Let me see if Facebook got any questions. Forgive us. I did. Hold on. Let me make, before you get off, let me see if Facebook have any questions. I don't even know. Sorry, y'all. We didn't let y'all. It might not be anybody on there. Is everybody good? Yeah. I may have to let my doctor go. See, everybody about to throw away their doctors and come to you.
I don't know what mine. As soon as I charge my phone up, that's another doctor.
Oh, she said, are there supplements you would suggest to take to help your immune system while we live with COVID?
So, let's see. To fight off COVID, so there are a couple different things I do for COVID, but of course, making sure that you're doing multivitamin will start there to make it easier. And then you can do like your zincs, your vitamin D, and your vitamin C, but probably the main ones that you're doing already, or the ones that you do typically when you have a common cold or flu, those same things, I would say. But supplements kind of, they work for some people and some people they don't. So I would say stick on more of the vitamin and mineral range, just because, our bodies, we can't consume all of the vitamins and minerals that we actually need. So by taking supplements, that kind of helps to aid. So we can't get all the vitamins and nutrients that we actually need from just our food. So that's why supplements are sometimes important. And just for another plug, starting in August, we're going to start doing what we call IV hydration and vitamin infusions. So that's something we'll start in the summertime as well.
I am so amazed right now.
Get your cars. We're going to carpool. Just go have all our appointments at one time. Come to see you. I do have a question for you. What do you suggest about allergies? Because my allergies are horrible this season.
But if it's just your allergies, I'd start with just an over-counter antihistamine,
That ain't
like
working.
Zyrtec, Claritin, or whatever, just to see.
That ain't working.
Well, then we need to talk.
I'm trying to over the hill.
Well, then we need to talk, then.
Snotty nose. What does this little boy off from Martin? What? Yes.
Have
I
you
had
had a
to do
COVID test?
for my job. And we're not doing what is it? We're doing the 2-day one.
Oh,
We
okay.
don't do the, what is it? Rapids. No, they said that's a no. We don't do
Rapid.
that.
Mm-hmm.
So it's not that. It's my allergies are horrible. My son got in the car yesterday. Talking about, why are you crying? Child, this is not me crying. This is my allergies
Oh, wow.
is horrible. So he thought I was in the car crying.
We just need to chat.
She said she got a question.
What can we take for energy that is natural? Not energy drink, but natural.
I take my energy drinks. I'm sorry.
So when you think about energy, the one thing you want to think about is what are you doing already first. Sometimes some of the things that you're doing will deplete your energy. Instead of you worrying about what you can put in, is there things that you can stop putting in? So stop thinking about what I need to put in. What are the things that you're putting in that cause you to be sluggish? Are you eating a bunch of sugar? Are you doing caffeine? So there's a whole lot of different things that actually cause you to be sluggish. So maybe we need to stop some of that stuff first and then figure out we need to go back and put some stuff in. So there are many different things that we do to our bodies that actually make us sluggish versus thinking about, okay, what should I take to keep me from being sluggish? So it's kind of, again, it's one of those things, it's case by case. You got to kind of look at the individual to say what's going to be the best course of action. But one of the things I will say as a provider, I am big on, if we take medicine all the time to heal us, then there's probably some other things that we can eat to heal us too, besides medicine. So I'm not always into just take medicine. Let's talk about what we're putting in our bodies. Because sometimes if you, did you get your papers? There you go. All right, good night. Thank you, Beth. So we got to start thinking about what we're putting in our bodies first before we decide, should I take more medicine? Because you might could just stop doing some stuff and get more energy. Like I don't eat meat. And I found out once I stopped eating meat, I had a whole lot more energy.
That's gonna be hard.
Listen, I'm a stress eater, so I eat a lot of sugar, a lot of cupcakes and stuff.
Oh my. Yes. like cakes, cupcakes. Renee, where you at? I'm at Whole Foods.
Go to the donut. So I already know listen, you have
sugar,
to I know my
sugar will take you up, but
I know when I'm a stress eater. So guess what? I'm
there you
eating
go.
donuts, cupcakes,
right now.
like
We'll host a sticky cake.
Yeah, like Red Velvet. They done told me about a place down the street from my shop. I went there Saturday and I was there yesterday.
Oh my God.
Listen, I know what to do. I need to lose my weight. I already know. I'm a stress eater. Let me tell you something. I don't know about nobody else, but when you are doing business and you working 9 to 5 and you take care of kids and you're a single mom by yourself, Lord, let me tell you something.
A cake does not stand a chance.
It makes me feel good. I'm gonna do better though. I'm gonna do better, Miss Nurse Practitioner.
Well,
I'm gonna do better.
I'm gonna give you some free advice.
Pray.
Free advice. If you don't have it, you won't eat
You're
it.
right, because I don't hardly, I only ever buy it unless I am stressing. Let me tell you something. There is a gas station that's up the street from me. One of these two will be on the phone with me. Where you at?
I'm going to the gas station.
I'm going to the gas station. Because this I don't know what it's called. It's not a donut. It don't have a hole in the middle, and it got a thin layer of chocolate on it.
You need to stop.
That and an energy drink.
Hey, Claire.
My thing is One Bell Bakery. Girl. They make a almond cake.
It's so moist. Oh my God. So much.
So do it in moderation. I mean, you don't have to stop having sweets, but do it in moderation. You can't have one. You can't have every time you go past the gas station, you can't go get one of those eclairs or chocolate covered donut things you get. And eclair.
You go get coffee. But you know what? And one of my friends, he'll laugh at me like, what are you doing? And as soon as I say I'm doing it, to my, all right, what's going on? You stressed out. What's going on? Because I know all about the health and everything, but I literally, that's my stress report, and it makes me feel good at the moment. I'm going to do better. I was doing better, and then I got stressed out again. It's bad. So I'm going to do better. Now that you're probably going to push me.
Okay.
But thank you so much. Like, I cannot tell you how valuable this is to everybody. And it also will be uploaded on the podcast. So whoever missed it, once again, we're on YouTube, we're on Spotify, we're on iHeartRadio, Google, and Anchor. And plus these 3 main physical platforms. So there are 7 ways that anybody can see us. And the handle will always be Brilliant Brains of Women. And I'll put that information up. And I'm definitely going to put your information up because this is good. This is amazing. And if anybody don't have any questions, I know you're busy. I know we took up a lot of your time, but it was worth it. Do you have anything else for us?
No, I enjoyed you ladies. I'm very honored and appreciative of the invite to, you know, just to sit back and kick back with you guys.
We were missing. Yeah,
well,
we were missing.
You should have told me I'd have had.
But stuff like this is what keeps us going. This is so good. So
gotcha. Yeah, and what you guys are doing is beneficial too, and you know, just being able to communicate and converse about different things. I looked at a couple of your or some snippets of a couple of your previous shows, and you guys got some good conversations going on. So keep up the good work. It's definitely needed. What you're doing is definitely needed.
It gets a little tough sometimes, but this is what this is pushing and keep moving forward. It just is, and thank you, like I said, thank you for the encouragement because we definitely need it. Hearing things like this definitely makes us keep going. So we love you over here at Ladies Kickback Tuesday. Brilliant Brains of Women. We see you later.
Thank you.
Bye.
Thank you, ladies. All right. Have a good night. Bye-bye.
So, Facebook. Yeah, I think she might be able to cook it off. Yep, she going. So, Facebook.
Oh, that was so
Instagram.
Good.
This was amazing.
Oh,
and if you guys have any requests or anything that you guys want us to talk about, or even if you do want to be a guest on the show, please contact us. You can inbox us on any of our platforms, or we do have an email. It is brilliantbrainsofwomen@gmail.com. Yeah. And again, it's brilliantbrainsofwomen@gmail.com. So if you guys want to be anybody want to be a guest or anything, please do not hesitate to reach out to us. If there's something you guys want us to talk about, a topic or anything, we're definitely that's what we're here for. So if you guys, I know it was a little longer tonight, but it was definitely worth it.
It really was.
And so I'll definitely put that information up sometime. If it's not tonight, it will be actually tomorrow. I think somebody else is talking on Instagram. You see it?
I just picked it up.
Okay.
Somebody said, like I said, great conversation.
Hey, Oluwai! I just asked about you. That's her husband.
That was a good one.
Thank you, everybody. Thanks for thank you for supporting us. We're great here. Appreciate it. But we will see you guys next week. Same time, same place. Please share this live. Like I said, it will be uploaded on YouTube and on all our other platforms. We thank you guys for participating tonight and coming and showing us love. You guys have a great night. Bye.
Bye.
Bye. See you later.
Later. You can stop. They don't see you. That was a good one.
That was good. Like that. Did you have a shot tonight, sure? Did you have a shot? What you mean? It was real good tonight.
You was kind of giggly.